everyone, this is Dr. Priyadharshini, one of the mentors at StudyMEDIC, and today we are going to discuss a module of urogynecology for our Part 3 exams. So before I start, thank you Dr. Priyadharshini Ghosh for being my role player. So let us try to understand the module of urogynecology and what's important. Urogynecology can come as a structured discussion where the urodynamic graph can play a major role, or classification of POPQ or a post-hysterectomy wall prolapse can be taken up for a structured discussion. However, the stimulated patient task can also be in this module. It can be reflected in terms of urinary incontinence like urge or stress, or use of pessary, post-surgery, post-op complications. Anything can come in this module. So the candidate instruction is going to be for 2 minutes, followed by the discussion of 10 minutes. Now, in candidate instruction, the most important ones are how are we going to read, what we are going to read. So in the 2 minutes, let me start my timer. And let us see what are the important things we are going to do in candidate instruction. Point number 1, we need to understand whether it is a structured discussion or a stimulated patient task. Second thing, we need to understand what are the domains we are going to be tested on. In this particular case, it is a simulated patient task. The domains are information gathering, communication with patient safety, and applied clinical knowledge. Following that, we need to understand who are we, where are we, and what are we going to do. So ST5 in the gynae clinic, the patient is come for a routine follow-up after surgery. The notes are missing. That's the first thing. But however, you have a discharge summary following her operation. So this is discharge notes. So we need to go through the notes. We need to understand that she's undergone tension-free vaginal tape, and the doctor's name is also available there. Important comorbidity of diabetes. So here completes the candidate instruction. So I think we can start our 10-minute discussion. Dr. Priya, are we ready?
Yeah, we're ready.
Yes. Hello, I'm Dr. Priya, one of the doctors in the gynae clinic. Today, may I confirm your name and age, please?
Hello, doctor. I'm Anna Hilworth and I'm 51.
And how do you like to be addressed?
Anna is fine.
Oh, thank you, Anna. I understand that you have just recovered from your surgery. So how are you coping up with it?
Oh, I'm so happy with the surgery. I've not had a single leak in these past 2 weeks. And I thank you so much, all of you. God bless all of you. I'm so, so happy. This has been such a relief.
I'm really glad that you're happy after the surgery. That's really good to know. So, Anna, before I would start, let me just tell you, I'm having my apologies because my consultant is just away in an emergency. However, I'll walk you through the routine follow-up, and I will also would like to do an examination just to make sure that everything is fine with you. And I will be talking you to about the next follow-up and the series of other things that you need to do. Is it all right?
Yes, of course, doctor.
Yeah, that's lovely. So Anna, I'm also sorry that we do not have the clinical notes right now, but I had the discharge summary typed in right in front of me, and I also confirmed that it is your discharge summary, and I also have details of your surgery. Okay,
Okay,
so I
great, doctor.
confirm
Yeah.
this. Yes. I will make an instant report that this is missing, and I will take the necessary actions for that. So getting back to you, Anna. So how do you feel after the surgery? I understand you're a diabetic. So how well was your sugars after the surgery?
So my sugars were pretty well controlled, doctor, on diet, and I was on this tablet called metformin, and that's why the doctor who did the surgery said, "Okay, I can go ahead with it because everything, all the sugars looked fine."
Okay, okay, that's good. Now, have you started resuming your daily activities?
Well, yes, most of them, but no, not I've not gone back to any sexual activity as of now. Well, my current partner, we're just getting comfortable knowing each other, but I'm
Mm-hmm.
hoping that it's going to happen soon, and that was one of the reasons why I was so eager to get this surgery done.
Mm-hmm. Well, I'm good that you opened to me about all these information. I will make a note of all that, and I will also do an examination just to make sure that everything is fine down below. Is it all right?
Absolutely, doctor.
Yeah. Before that, Anna, is there any other concerns that you are facing right after the surgery?
No, not really. Like I said, I'm very happy with the surgery. All the symptoms that I had, those problems of leaking and sudden accidents, they've all gone away.
Okay, that's really good to know, and I'm glad we were able to help you that way. So, with your permission, I have my chaperone right next to me. Can I do an examination down below?
Yes, yes, please, doctor.
Yeah, thank you, Anna. So, Anna, that completes my examination. Is there any
So
pain?
is
Are you
everything
comfortable to
no,
talk?
is everything all right, doctor? Because no, I don't have any pain. I am not feeling anything additional that I should tell you about.
Okay, okay, Anna. That's nice. Thank you. However, Anna, I see that you're completely pain-free and you're doing quite good after the surgery. But however, I need to tell you some very important information right now.
Okay.
Is it okay if I can go ahead?
Yeah, yeah, sure, doctor.
Well, I'm really sorry that I have to break this news for you. When I did the examination for you, I see a small part of the mesh, that was used to do the surgery has come out via your vagina.
Why would that happen? I mean, I don't feel anything.
Well, Anna, it might take some time for you to actually notice the meshes come out. Probably when you start your sexual activity, your partner can also complain a bit about it. This kind of mesh erosions are quite common after the surgeries. However, we will take the necessary steps, and I will also be talking to you about what best can be done for you. Is it okay?
Yeah, sure, doctor, but do you think something went wrong during the surgery? Maybe you could have a look at the notes to understand that.
Yes, yes, definitely, Anna. I will definitely go through your notes once again. But let me reassure you, it's not always with a faulty technique. However, faulty technique can be associated in a minority of the cases. In your case, it can be associated with the diabetes that you already have. So, the healing, of how good your vagina is going to regrow after the surgery, that can be one of the factors. Your age can be another factor that could have caused, the mesh to have come out.
Okay, okay, so now what, doctor?
With the bad news that I've told you, I also have something good that I can share with you. Is it okay? Or on a better note?
Yeah, sure, doctor. I'm a little anxious now, you know.
Yeah, I understand your worries, but do not worry, Anna. We have definite options for this which can help you feel better and get relieved of this complication too. So, can I
Okay.
tell you what all we can do for you?
Yes, absolutely.
Yes. So Anna, when I see the mesh, it's not a very large portion of the mesh that's come out. It's a very small part of the mesh that I can see right now. And for this, we do have conservative measures which can help you, which can help the vagina regrow over the mesh and prevent it from further complications. You know,
Okay, and what if this does not work? Do you need to take out the mesh?
Well, Anna, that can be considered if this is not going to work. But however, before going into that decision, I would like to have my consultant by the side and also the team of doctors who can take up the decision for you. Because it's really a very big decision, then you can have a mixed discussion with everyone together. Is it all
Yeah,
right?
doctor, maybe we can start with what you just said because I don't want to go back to what I had before this surgery, you know. It was very troublesome.
Definitely. I certainly do understand what all you could have gone through in all these months together. Do not worry, we can start off with this treatment for you. I will definitely document what all I have seen today, and I will put a word forward to my consultant, and I will call you back to have an appointment with him too. And following that, you can think about other options also. So let me also reassure you that in majority of the women, when a very small portion of the mesh is being exposed, the conservative management actually works very well. It help the part down below, the vagina, to regrow over the mesh so that you do not have to face the complications again. Am I clear?
Yes, but is there anything that you can give me so that this regrowing, you know, is faster or something like that?
Yeah, definitely. I will help you with some, topical estrogen ointments, which can actually help the vagina regrow better. Considering the age, having a good vaginal regrowth is really essential, and these topical hormones can help it grow very fast. And also, when you start your sexual life, the vagina will have a better, what do I say? It is going to be in a better place to have your sexual um, uh, uh, it is going to avoid you from all the sexual problems too, which women can face in their older age. So, am I clear with that?
Okay, okay, doctor.
Yeah, okay. Thank you, Anna. So, I am just making a note of you, and I'm also giving you the prescription right away. And following this, I am going to talk to my consultant and fix an appointment and get back to you at the earliest. Is it all
Yes,
right?
yes, doctor. Yes, thank you so
Yeah,
much.
so so as of now, I would also say that you need to have a very good control of your diabetes, and you need to report back to us when you're feeling anything funny down below, or if there's any kind of disturbance, then you need to report to us immediately. Is it all right?
Yes, sure, doctor. I'll do
Yeah,
that.
and I'm also giving you these papers which you can go through. These are about the surgical complications that women can face after these surgeries. I believe that it was already discussed for you before the surgeries, but also it would be a good look if you can have a look at them and understand what's happening with you. Is it all right?
Yes, doctor. I'll do that. Thank you so much.
Yes, yes. And I'm also giving you the emergency contact numbers here. So, just in case if you feel any difficulty, you can get back to us. I will arrange the meeting with my consultant at the earliest and I will get back to you.
Okay, thank you, doctor.
Thank you, Anna. So, this was the station, and the station had the role player. And let's start with some feedback from Dr. Priyadharshini Ghosh.
Yeah, so Priya, it was really well done, station. You built up a rapport and you actually told her without making any two ways about it that there could be even a faulty surgical technique. However, that was not the only thing, which is very important to tell the patient that that is part of the complications. And you
Mm-hmm.
also informed her that her clothes are missing, although she was upset, but you handled her beautifully. And when she said that, can you give me something more, you talked about the vaginal estrogen cream. That is good. However, there I do feel that in this kind of a scenario the patient would could be more upset than this particular patient. She could be really
Sure.
angry at you. So we would have to be prepared for that as well, because that could be one of the twists or turn of the station. Apart from that, you completed everything. I don't think there was much to say, but I would also like you to add in the later part of your video that when the candidate instructions are given, in more cases, also the examination findings are given. And therefore, there we do not require to say that my chaperone is here with me, because we are not expected to examine the patient. So
True.
that's it. But other than that, very, very well done, very well handled. You handle the patient really well. So yes, good work.
Thank you so much for that. Actually, this was one of the exam stations that I faced in my exam. The only thing is, many of the candidates did not ask for the examination finding.
Okay, yeah.
So that examination finding actually came in as a bouncer to many.
Hmm.
So the basic idea was, okay, this is Eurogynae with a post-op. So patient has come for post-op, talk about post-op and follow-up. And when few of the candidates asked for the examination findings, that is when the mesh erosion came up.
Erosion came
So
up,
the mesh
right?
erosion was basically a hidden agenda which they had to find. So it was again not mentioned in the candidate instruction, but that played a very, very vital role because the station can altogether change into a different one, a post-op complication with a mesh erosion,
Hmm.
rather than just being a normal station. So
I
that is
agree.
the
I
point
completely
we
agree.
wanted to highlight. Yes,
Yes,
yes.
yes.
So asking for additional information is very, very important because it is that vital information that's going to decide the agenda that's actually present in this complete station. And you are going to have four different domains, and the decision of pass, borderline, or fail is going to be you're going to take points from all the four domains. So having a good knowledge of everything is really essential. So you need to identify the patient. The tape exposure is not life-threatening. Involve your consultant. Risk management. Incident report because the file is missing. Information gathering. Having a targeted history. You're not going to sit and ask her A to Z because she's a post-op patient, and how she was already evaluated for the same and operated. So you're not going to sit and ask all the history. And however, understand you need to ask how is her post-op recovery, how is her diabetic control, and any complication she's having right now that needs to be gathered. Examination is again a part of information gathering. The most of the information are already given to you. However, the hidden information needs to be taken up. Establishing a good rapport is very important, because the minute you want to talk about mesh erosion, the patient is going to get angry, or as Dr. Priyadharshini was saying, so you need to handle the patient also. As whether she's resumed sexual activity, it is important. The patient had already mentioned she's not, because mesh erosion, sexual activity, again, there can be some difficulties which needs to be addressed also. So this element of talking about the post-op complications can be taken as an element of Breaking Bad, because to start off, the patient was very, very happy. The role player was extremely happy and satisfied. But when you're telling her such a bad news, so she's anxious that, she might get back all her old symptoms, and she doesn't want to go back to that. Though there is a complication, we need to be very honest with what we're telling her. We are going to tell her the correct things. We are not going to falsely reassure her. We need to talk to her about the follow-up plans also. So mesh erosion, what are the risks, what are the management options we have for her? Involving an MDT is very, very important. So this was the role player instructions we were having, and she had beautifully covered everything. And always following the role player is very essential, because the role player knows what is the station there. So anytime you're deviating from the agenda, it's a role player who's going to bring you back. So role player is actually the lifesaver in most of the stations. Key points: read the candidate instruction, know the domains that are being tested, have a very, very good rapport with your role player. Role player plays a very vital role, especially in neurogyny. You need to understand the psychological issues and the sensitivity, because the patient would have already been distressed with many of the urogynecological symptoms, which they actually cannot tell out openly. And following the surgery also, these symptoms can recur. So understanding those issues are important. Have a standard template. Do not miss on the basic points of urogynecology history taking and information. Ask for examination so that you will not miss on some really, really significant information. So thank you so much, guys. Do subscribe to our YouTube channel. We have a lot of videos which is going to help you for exam preparation. Thank you, Dr. Priyadharshini Ghosh, for helping me out with the station, and for all our candidates. Thank you once again.
Thank you so much.